Good morning. Thank you for the presentation. I'm Joana Figueiredo from the University of Minho, from the Berg Group, and I will present our work related to wearable virtual reality tool for balance training, in particular the design and validation on healthy subjects. In fact, there are a number of people that present loss of balance due to neurological disease, ear disorders, due to the age or even some kinds of medications. And as consequence, these people present high risk of falling and they have difficult to perform their activities of daily living. So these decrease their motor independence and quality of life. So these people should be involved in balance rehabilitation to recover their balance function, which can be achieved by neuroplasticity. It can be achieved by involving these patients in physical rehabilitation or in robotics rehabilitation. And this one use robotic device that based on objective assessment of the balance function is able to provide intensive and user-oriented therapy. Currently, directions have highlighted the potential of virtual reality tools to complement the conventional physical therapy because they are able to immerse user in a virtual reality environment that is customized to the user needs. So it has potential to accelerate recovering processes. We have analyzed the literature and the current virtual reality systems for balance training. They like because they still present they are not able to present a full immersive system. They do not follow a user-centered design because they do not provide a balance training according to the user's most performance activities of daily living. And also the current solutions are non-wearable device, so they are not ready for assisting the patients outside of the clinical settings. So in order to overcome this challenge, we have developed this study, which aims two main goals. The first one is to develop a wearable and full immersive virtual reality tool for balance training with a user-centered design centered on the user, so focus on user most performant activities of daily living and also focus on the most performant, most tasks recommended by the clinicians. And the second goal aims to conduct a proof of concept by performing a validation with healthy subjects to find evidence regarding balance effects and user experience by using this virtual reality tool. So firstly, we have identified the requirements to achieve a user-centered design. And for this purpose, we have identified firstly the technological requirements, and we verified that virtual reality technology and the sensor technology should be wearable device. We have also identified that the motor tasks involved in balance training and virtual challenge implemented so the people can perform these motor tasks. They both need to attend to the user most performant activities of daily living. And also we have verified that there is no system that is still able to provide multimodal feedback. So it is needed to take this need. And from the balance training requirements, we have identified the two most performant clinical balance training tests. That is the Berg Scale and Time Up Go test. And this one recommend these 9 motor tasks that should be addressed during the balance training. We have also identified which are the primary outcomes in balance assessment. That is the position of center of mass and the velocity. And we will use these metrics in our validation and assessment we use in healthy subjects. So based on these requirements, we have designed and developed this proposed solution of virtual reality. And regarding the virtual reality technology, we have used the HTC Vive system. Since it is a wearable device and it allows to fully immerse the patients in the virtual reality environment. And moreover, this setup is able to provide multimodal feedback. So you can, I see that you are seeing that, yeah, we can provide virtual vibrotactile feedback from the controllers and visual and auditory feedback by the headset. Regarding the sensory technology, we have used inertial sensor from the Xsense because it is a wearable system and it also allows to control the avatar motion based on real-time information from the users. Taking into consideration the 9 motor tasks that we have identified that should be addressed, we have implemented 4 virtual reality environments. And these environments were implemented in the house scenario because it is the scenario with people with loss of balance spend more time. And so the user is asked to perform these motor tasks in this virtual scenario while receiving feedback regarding its position and orientation of the segments and center of mass. It is also important to note that the therapists can follow the user performance by seeing the environment in the screen. So here I present the 4 implemented virtual reality challenge. And the first one, the fruit catcher, it aims to train the people in 2 motor tasks. The first one is stepping, and for this purpose, the subject has to climb 6 stairs. And the second motor task that we are using aim to train with virtual challenge is to weight shifting. And for this purpose, the subject is asked to catch 9 apples. And it is important to, as you can see in the video, and it is important to note that the distance of the apples were set according to the Berg scale instructions. In the second virtual challenge, to take a shower, we aim to the training the balance while standing on one leg. So for this training, the people is asked to first entry on the tub by performing flexion and extension motions. And after is inside on the tub, is asked to standing on one leg for 10 seconds. And when the people reach the foot high threshold, it hears this auditory feedback, that's the sound of running water. In the third, the cooking scenario, we aim to train different motor tasks. So the weight shifting, knee flexion and extension, and hip movement. And for that, the people has to put the feet in parallel, and without move the foot, he has to catch 6 ingredients to cook something. And it is important that we have adjust the shelves according to the user height. And in the last one, sorry, okay, watching TV. Okay, and in watching TV scenario, it replicates time up go test. So the people starts in stand position. After that, sit on the sofa and walk for 3 meters until they reach the TV. And when reach TV, it provides the video, another auditory and the visual feedback, and then it goes back to the initial position. And this virtual scenario aims to train the stand to sit, sit to stand, and walking function that are most performer activities in home. It is also important to note that the user can see the first perspective person view, and also if you realize on the videos, it can also receive feedback regarding the center of mass in the second view. So after this implementation, we perform evaluation, experimental evaluation with six healthy subjects, and they were firstly involved to perform a baseline assessment, to perform the Berg scale and the time up go test while using the XSense for an objective assessment. After that, the people perform a virtual reality training session that includes 2 trials per each virtual challenge, and at last it perform a post-study assessment similar to the baseline with addition of a questionnaire. And during this intervention, we have collect these measures with focus on primary outcomes, that was the center displacement of center of mass and the maximum and minimum velocity of the center of mass. And based on these outcomes, we perform a statistical analysis with a significant level of 5% in order to verify the difference between the first and second trial and the difference between before and after the virtual reality training. So regarding the results, during the validation, we have in fact verified that the implemented tool was effective and efficient. And regarding the balance outcomes during the virtual reality training, we have verified that the tool was able to improve the velocity of center of mass, and also it was able to decrease side-by-side movements during walking. However, we do not find significant difference in the 2 virtual challenges, the fruit catcher and the take a shower. It can be explained because we tested firstly in the healthy subjects, and we involved the reduced number of training sessions. Regarding the results before and after the application of the virtual reality tool, in fact, the results indicate that the implemented tool was able to improve the displacement and the velocity of center of mass in both static and dynamic motor tasks. And these results were significant, and which is standouts and innovates regarding the literature, because they still not provide significant improvements. Regarding the results from the questionnaire, we have verified that the subjects report a positive experience while using the system, and they indicate the system was able to present a high sense of presence, involvement, and realism. So this high acceptability is important to achieve faster and better balance improvements. We have also, the users also indicate that the system provide a high interest and perceived competence while performing the four virtual environments. Despite the high effort that they have reported, they indicate that the system presents low tension and it presents high value and utility because the system was able to help them to understand their balance limitations, and also it helped them to increase their balance, mobility and stability. In conclusion, we have this study as proposed and innovates by proposing a wearable and full immersive tool for balance training, which follows a user-centered design on user needs and on balance training requirements. The perform a preliminary validation on healthy allows to verify that the tool has potential to improve the balance, and it also presents high acceptability. So we can verify that the tool has potential to be transferred from clinical application and to complement the conventional balance therapy. As future work, we aim to perform clinical studies with end users people. Thank you for your time.
For this wonderful presentation, very interesting. I don't know if someone has questions.
Two questions, in fact. The first one is, how do you cope with motion sickness? Because I know that a lot of patients, especially when using virtual reality first time, they get sick before they actually complete the training because they cannot cope with this like balance stuff in combination with the virtual reality.
So for this, we have, I do not mention here, but in the paper that information is there, the people as first familiarization period, the end users, and also we have set a maximum duration for each virtual challenge that was 3 minutes. It is specified according to the clinical recommendation for the application of this system with people with loss of balance. So the subject, the patient, can only perform each virtual challenge for a maximum of 3 minutes, and then it can rest for some time, and then it can repeat the process with the other virtual challenge in order to avoid this kind of issues. Yes.
And then the second question, do you plan on having more subjects? Because I think it's
Yes, okay. We agree with you. We have verified the minimum. It is usually five persons, so we includes 6 subjects. This evaluation was more focused on to verify if the system can be easily understand and the acceptability, because these outcomes are not relevant because they regarding balance function because it was tested on healthy. So our aim now is to test on people with loss of balance, and we are dealing with some issues because to achieve ethical approval from the hospital it takes time, so we are handled with it for them to test with that kind of people.
Okay, thank you.
Welcome.
Thank you for your questions. One of them I was also going to mention about it. I don't know if I have other questions. So maybe, Joana, you could just better clarify if when are we moving to the hospital and
The challenge?
yes.
Well, the first challenge is to select the participants, and we are considering people that have suffered a stroke, for instance, the first use case, or for instance, people with ataxia. And we aim to firstly provide a familiarization experience, so the people can feel comfortable using the setup. We have also to select a room with some space because it's for the people walking freely. And we have also to include a therapist because it is a training session, but it should be followed by an expert on the physical therapy.